Hello and welcome to 5 Minute Pharmacology. Today we're going to be talking about the drug lidocaine. Lidocaine's trade name is xylocaine. Its classification is an antiarrhythmic local anesthetic agent. It's carried 100 milligrams in 5 mLs, and we currently only carry this in one Bristol jet. And it's usually located within our, for the use of our IO. So Pharmacology and actions of this drug is an antiarrhythmic drug that decreases automaticity by slowing the rate of depolarization. So it does this because lidocaine works on the sodium channels and it blocks them. So therefore, it reduces the rate of contractions. But lidocaine can also be used um, as a nerve block agent, and it can inhibit signals traveling to and from the brain when injected near nerves. And so that's another way lidocaine is used and how it can decrease or eliminate the sensation of pain. It's used in that way as well. So, but it does this by blocking sodium channels. And within the heart in itself, why that lengthens out or slows down, erratic rhythms like ventricular tachycardia, is basically it decreases the conduction or automaticity of these cells, which increases the recovery time that the cells need, and therefore, terminating, those super fast rhythms. So um, that's what it gets to the second point here is it terminates reentry by decreasing conduction through reentry pathways, and it is also used for local anesthesia for pain control. So some indications: cardiac arrest due to VFib or pulseless VTAC, wide complex tachycardias with a pulse, and pain management after IO insertion. And that's typically how you're going to see this given for us in the field, how we carry it. We do not carry lidocaine as a pre-mixed bag for infusions anymore. Um, we did used to carry lidocaine and used to deliver lidocaine in a bolus and infusion form. However, we don't carry it and use it for those intended purposes anymore. So, some absolute contraindications is bradycardia and a lidocaine allergy, and some side effects that you may see is in higher doses. It may cause CNS stimulation, seizures, depression, and respiratory failure. And toxicity is more likely in elderly patients and patients with impaired livers or congestive heart failure. So the IV onset is less than 3 minutes, and its peak effect is 5 to 10 minutes. The guidelines in which you will see this medication is in the tachycardia with a pulse, so stable, regular, wide complex tach. The dose is 1 to 1.5 milligrams per kilogram. You may repeat half the original dose every 5 minutes to a max total dose of 3 milligrams per kilogram. Um, I will tell you this was probably one of the most difficult infusions when we would hang it, just because you would have to start with your loading doses and then switch to your infusion dose, and that was kind of a lot to do. Whereas amiodarone, which does similar things and is given for identical indications, was a lot easier to give. Um, you also see this drug in cardiac arrest protocol, in which you may give it for shock refractory to from VFib and um, pulsus VTAC, and that is 1 milligram per kilogram, and you may repeat that half original dose every 5 minutes. And then the way we would see it in the field currently is for our EZIO administration for anesthesia, 40 milligrams over 2 minutes. PEDS dose 0.5 mg per kg, flush with 10 cc flush after 60 seconds. Repeat dose 20 milligrams um, over 1 minute. So PEDS is half initial dose, and you can repeat this as needed. So um, I hope you learned a little bit about lidocaine. Just remember when you're pushing that into the EZIO, just let it sit for a minute before you do your flush. Otherwise, it's going to be painful no matter what to that patient. Let the drug work. Um, I hope you learned something about lidocaine. Make sure you like and subscribe. Thank you.